Hello again. We talked about the shortness of breath and the need for oxygen last time. And I thought I'll continue on the same for this particular video. There are many causes why the shortness of breath can occur, and there are many causes why the oxygen drops, even though the essential mechanism is pretty much same for the oxygen drop, which is imbalance between the air going in and the blood going in, or a mismatch between the two. The shortness of breath can occur because there may be an increased work of breathing. For example, what we see sometimes with stiff lungs. It can also happen because someone has clogged arteries from a clot, or it could be because the patient has scar tissue fibrosis that leads to, again, increase in work of breathing. Imagine somebody sitting on your chest, even though your lungs are normal, even though the oxygen is normal, you will feel short of breath, because to get a breath in, you have to lift 150 or 200 pound person sitting on your chest. So the amount of energy and the work of breathing is so much increased that you feel short of breath. Another cause which is commonly seen is with clot in the lung or pulmonary embolism. Pulmonary embolism is where there is a clot which usually arises in the lower extremities or legs, what is called phlebitis, though it is a deep vein thrombosis, not superficial, travels through the big blood vessel called inferior vena cava, goes to the right side of the heart, and then when right side of the heart, when it pumps the blood to the lung, gets clot in the circulation. This particular blockage causes drop in oxygen because, if you remember, the blood is not going to the areas where the air is going, which causes the mismatch, and that leads to the drop in the oxygen. But in normal people who have normal lungs, the oxygen may not drop substantially, but they will feel short of breath. The experiments were done in dogs to see just throwing the clots, maintaining adequate oxygen saturation, they did start panting or short of breath. Again, this has to do with certain stretch receptors. So a work of breathing being increased from various stuff to clot in the lung or pulmonary embolism can cause shortness of breath. Usually, this is associated with drop in the oxygen, and oxygen supplementation may not reduce the shortness of breath till part of the clots are dissolved, either by body itself or by medication like blood thinners given to somebody. A condition called pulmonary fibrosis, where the lungs have scar tissue. So if you know, any inflammation or injury leads to scar tissue. So let's look at the sequence. If I have a injury to my arm, let's say there is a cut, the body tries to mend it, and doing that is an inflammatory cells, and it heals with scar tissue. So an injury, inflammation, healing with scar tissue is a common thing in the body. If that happens in the lungs for reasons that are not very clear, or for the reasons that are very clear, then you get pulmonary fibrosis. When the reasons are not very clear, what caused the injury is not clear, you end up with scar tissue called pulmonary fibrosis. And this, as you can imagine, this fibrotic lung is not a normal lung, and so people feel short of breath. The scar tissues can also happen due to other conditions, something like rheumatoid arthritis, lupus, scleroderma, sarcoidosis, and many other infections and other conditions, exposure to toxic gases, where the injury occurs and then you heal with it. Recently, with the COVID pandemic, I've seen about 2 or 3 or 4 patients with scar tissues that occurred or got worse after the COVID infection. Again, as you can imagine, injury, inflammation, healing. Normally the lung heals with perfectly back to normal lungs, but in some patients, it heals with scar tissue, and that leads to difficulty in transfer of oxygen as well as work of breathing being changed. So people are short of breath and they may drop or they do drop oxygen. So pulmonary fibrosis is one more condition where you have shortness of breath and oxygen drop. So the next one would be like structural problem with the skeletal. For example, people that have severe scoliosis, the mechanics of the rib cage movement is altered. So there are two conditions: kyphosis, which is backward bend of the spine, which is different than the scoliosis, which is like a curvature of the spine going right and the left side or coming to the midline. In scoliosis, one lung becomes smaller and the other lung becomes bigger. This distortion of the lung itself causes air sacs and the circulation to be distorted. And the mechanical lifting of the rib cage, if you can imagine a bucket handle movement, that's how the rib cage moves. So these are the ribs, my fingers showing here. They move up and down, and that particular movement is distorted when you have a skeletal deformities. And that leads to a mechanical problem that leads to shortness of breath. This also can lead to additional problems structurally, which includes pressure in the lung circuit being abnormal and oxygen drop. So not all scoliosis have oxygen drop, but if it is significant amount of curvature of the spine on one side, right or left, then people are going to feel short of breath, especially when they exercise, because increasing the respiratory rate with deformed chest becomes difficult. So musculoskeletal disorders can happen. There are additional ones which are described, like calcium deposits and calcification of the rib cage, etc. But those are uncommon, but scoliosis is certainly common. Similarly, if there is any muscular weakness, like muscular dystrophy is where the muscles of the breathing are weak. So the weak muscles get fatigued quickly. So when the work of breathing is increased, like it happens when we do exercise, then these muscles get fatigued and the movement or the breaths are shorter and smaller, and oxygen will drop and the carbon dioxide will build up. Again, in the early stages of muscular weakness or muscular dystrophy or myopathy, this is not common. But as it starts advancing and respiratory muscles are involved, including diaphragm or intercostal muscles, then you're going to have a shortness of breath associated with buildup of carbon dioxide and drop in oxygen. Certainly this may not be obvious on chest x-ray, but certainly can be worked up. So muscular dystrophy, muscle weakness, myopathies are also cause of shortness of breath. The next one is extrapulmonary or lung, other than musculoskeletal and myopathies. For example, somebody has a fluid accumulation around their lungs, or somebody has a fluid in the lung. Both these conditions can happen with congestive heart failure. When the heart is not pumping enough blood, the left side doesn't pump, it all gathers in the lungs. A lung is like a dry sponge. When it becomes wet, filled with water, then it becomes stiff. To expand that lung, and the transfer of oxygen is very poor. Subsequently, the oxygen will drop, people will be short of breath. People will also be short of breath in congestive heart failure because of the weakness of the heart muscle itself, which cannot satisfy the needs of the body, including the muscles of the exercise. So lung conditions like COPD, emphysema, asthma, pulmonary fibrosis, clots in the lung, pulmonary embolism, neuromuscular disorder, myopathies, congestive heart failure, fluid accumulation, etc., they all can cause shortness of breath, and in many, oxygen will drop. We'll talk about additional therapies in future. Thank you for watching. If you like it, please subscribe. Hope this is helpful. Have a nice day.